Imagine this scenario. Jake, a 25-year-old man, encounters a venomous snake. After receiving antivenom at the hospital, he finds himself a week later with body aches, a rash, and swelling of the face and limbs. Lab results show a slight increase in white blood cells and normal kidney function. No other tests reveal anything concerning. Intriguing, isn't it? What's going on inside Jake's body? Now, let's not jump to conclusions. Let's explore each potential pathogenesis of this puzzling condition. First up, we have tissue damage by the immune system. This is where the immune system, in its zeal to protect the body, damages its own tissues. This could explain Jake's symptoms, but it typically results in more localized symptoms rather than the generalized symptoms Jake is experiencing. Next, we have the precipitation of immune complexes in tissue. Immune complexes are formed when antibodies bind to antigens. In normal circumstances, these complexes are removed from the body. However, in some cases, they can accumulate in normal tissues like the skin, joints, glomeruli, and vessel walls, leading to inflammation and damage. Jake's symptoms could align with this condition. Then there's the local release of inflammatory cytokines. These proteins are released in response to an infection or injury, causing inflammation and attracting white blood cells to the site. But this usually leads to localized symptoms, not the widespread ones Jake has. The fourth possibility is a massive histamine release. Histamines are chemicals your body produces during an allergic reaction. A large release could cause symptoms like Jake's, but it would likely also involve severe breathing difficulties, which Jake doesn't have. Finally, we have T-cell mediated toxicity. This involves the immune system's T-cells mistakenly attacking the body's own cells. While this could explain some of Jake's symptoms, it doesn't quite fit the overall picture. After considering all these possibilities, the most plausible explanation for Jake's condition is the precipitation of immune complexes in normal tissue. His symptoms align with serum sickness, a type 3 hypersensitivity reaction. This reaction is likely triggered by the antivenom he received, which is a heterolus protein leading to the formation and deposition of immune complexes in tissues, causing systemic manifestations. So, to recap, Jake's generalized body aches, rash, and swelling are likely due to a type 3 hypersensitivity reaction known as serum sickness. This condition is caused by the precipitation of immune complexes in various tissue. While other possibilities were considered, they didn't quite fit the bill given Jake's symptoms and the timeline of his condition. With symptomatic treatment and supportive care, Jake's reaction should gradually subside. It's a fascinating world inside our bodies, isn't it? Unraveling the mysteries of pathogenesis, one case at a time, reminds us of the complexity and resilience of the human body. Until next time, keep pondering the wonders of medicine.